And you should have heard the little voice saying recording in progress. And I think you have to hit OK, and then we should be good to go. So I'm Christy Cooper. I'm the Family Support Director for Down Syndrome Diagnosis Network, or as we prefer, DSDN, because our full name's a bit of a mouthful. And I am joined by Katie Stoll and Dr. Stephanie Meredith this evening because genetic counseling is a topic that comes up quite frequently in DSDN groups, especially in our pregnancy group and our group for expectant dads. If you're like me, it's not something you even knew existed before you got the news that your child might have Down syndrome. And so it was a brand new world to me. And we see a lot of questions related to exactly what it is. How do I get connected with a genetic counselor? What are they supposed to do? What's the difference between them and a geneticist? So there's plenty of questions about exactly what genetic counseling is and how it works for you. So with that said, I am going to go ahead and do a quick intro for our speakers and turn it over to them because they are the experts. So first, Katie Stoll received her master's degree in genetic counseling from Brandeis University and has worked in diverse clinical settings, including prenatal, cancer, adult, and pediatric genetics for more than 20 years. Katie currently serves as Executive Director of Genetic Support Foundation, a nonprofit organization which aims to increase access to independent genetic counseling and up-to-date, fact-based information about genetics and health. She has worked to identify innovative ways to engage with patients and healthcare providers through telehealth outreach and development and dissemination of educational resources. Katie lives with her family in Washington State. Dr. Stephanie Meredith is the director of Lettercase National Center for Prenatal and Postnatal Resources at the University of Kentucky's Human Development Institute, where she develops resources for new and expectant parents, conducts research about prenatal diagnosis experiences, and develops training programs for medical professionals in disability cultural competency. She is also the mom of a 24-year-old with Down syndrome and 2 younger daughters. With that, I will turn it over to you, Katie. Thanks so much for being here.
Thank you so much for inviting me to be here. It's really an honor and a pleasure to be able to speak to the Down Syndrome Diagnosis Network on this topic of genetic counseling. As Christy shared my introduction, my only disclosure is really that I'm a full-time employee of Genetic Support Foundation, which is a nonprofit whose mission is to increase access to genetic counseling services. And I'll talk a little bit about the services we provide tonight. So I wanted to share that. Today, we're going to talk about kind of addressing some of these questions that Christy brought up. So who are genetic counselors and what is genetic counseling? What's the difference between a genetic counselor and a geneticist? Does insurance cover genetic counseling? What should you expect from a genetic counseling visit? And how can you work with your clinician to ensure that the next patient they see has the best possible diagnosis experience? So, and then hopefully we'll have time for some questions and discussion as well. So, Christy's not alone and never having heard of genetic counseling. Genetic counselors, the genetic counseling profession isn't actually new. The first training program for genetic counselors actually was started in 1969 at Sarah Lawrence College in New York, and there have been many master's programs that have trained many thousands of genetic counselors since that time. But I think many people don't hear about genetic counseling unless they have been referred to talk with a genetic counselor, have had some cause to talk with a genetic counselor for some reason. Genetic counselors initially really worked mostly in the areas of OB and prenatal care and in the pediatric setting, but increasingly genetic counselors are working in many different areas as genetics is becoming a bigger part of healthcare in oncology, in cardiology, neurology, research settings. So genetic counselors are in lots of different roles in healthcare. I'm going to focus a lot on what genetic counselors do in the OB prenatal care area and in pediatrics, as that relates, I think, most to what we're interested in talking about this evening. So initially, genetic counselors working in the prenatal space were there to help guide patients and help support informed decisions around prenatal testing. Back when the profession first began, prenatal genetic testing was really starting to become more common, including diagnostic testing like amniocentesis, and the type of screening for chromosome conditions, Down syndrome, and neural tube defects that kind of predated cell-free DNA screening and non-invasive prenatal testing, which was looking at these protein or hormone analytes and the blood, like the AFP test or the triple screen, the quad screen. And the goal of genetic counseling was really to help support families to help make informed choices about whether or not they wanted to undergo any of these tests, and then to help support follow-up of those test results. There are still many genetic counselors that are working in maternal fetal medicine clinics and high-risk OB clinics that are talking with families around genetic testing. I think it's become less common for genetic counselors to have a big role in talking with patients and families prior to screening test. I think screening testing through cell-free DNA screening through NIPT has become, it's done very commonly, and it's oftentimes ordered by the primary OB provider, and not something that people are having a lot of information or genetic counseling prior to those results. So I think more often now genetic counselors working in the setting are following up with people after they have a positive screening result that indicates a higher chance for a genetic condition or a chromosomal condition. They may talk with families who come with a family history of a genetic condition, and as they are interested in learning more about the chance that a condition could run in the family. And then genetic counselors are involved in that follow-up of information. If people do undergo testing, supporting the follow-up regarding those results, resources and support around a prenatal screening test or diagnostic test results. In the pediatric setting, genetic counselors work more commonly alongside physician geneticists, and they are often there to support families as they learn of a new diagnosis, to help make sure people can make informed choices around genetic testing in that setting as well, and helping follow up results with families, helping to coordinate and follow up with families around genetic testing that might have implications for other relatives, and helping support those next steps as well. So what is the difference between a genetic counselor and a geneticist? So genetic counselors have a master's degree, are board certified and licensed in many states. Clinical geneticists are physicians, so they are, medical doctors that also have special training and expertise in genetics. Physician geneticists work in many different settings as well, but I think most often we think about clinical geneticists working in the pediatric setting. There are some geneticists that have special expertise related to Down syndrome, but I think more often clinical geneticists are working in medical genetics clinics and oftentimes in children's hospitals or academic medical centers, where they are following up with patients and families who have rare genetic conditions or undiagnosed genetic conditions, helping to make recommendations and manage complex care for patients with genetic and rare conditions. So who would you see with a suspected or definitive diagnosis of Down syndrome? Would you meet with a clinical geneticist or a genetic counselor? And I think, or either, maybe neither a clinical geneticist or a genetic counselor in some cases. And I think that question depends a lot on where you live. I think there's a lot of probably regional differences state by state. Also, the healthcare system in which you get care. I think you may deliver a baby in a healthcare system that has a genetics department that is on call and does rounds to the NICU and sees babies when there's a question of a genetic diagnosis. and in that case, you might interact with the geneticist early on through that process. But if you have a diagnosis that's made prenatally or a screening test that comes back indicating a higher chance of Down syndrome, it might be more likely that you talk with a genetic counselor that's working in the maternal fetal medicine clinic, for instance. The wait time to be seen in a clinical or medical genetics clinic can often be quite long. There I'd say are not enough genetic physicians to meet the need for the services, and so some clinics have many months to even years of a waiting list to be seen. One question that came up, or one discussion point came up regarding Down syndrome clinics, and I think sometimes in addition to a specific genetics clinic, there may be a specific Down syndrome clinic. Sometimes Down syndrome clinics include genetics physicians, clinical geneticists on their team, and some do not. Some really have developmental pediatricians and pediatricians that are more generally specialized in this area, not necessarily with a background in genetics, and they're helping coordinate specialty care with other specialists like cardiologists or endocrinologists or other specialists that might be appropriate. I feel that part of the reason that oftentimes babies and kids with Down syndrome don't follow with a special genetics physician is because it's relatively a common condition compared to some of the genetic conditions that might be seen in a genetics clinic. And it's common enough that we have really good guidelines. Just pointing out the American Academy of Pediatrics guidelines on health supervision for children and adolescents with Down syndrome. So there are guidelines to guide even the general pediatrician to provide great care for babies and kids with Down syndrome. And oftentimes that's kind of the home base. I wanted to point out that in addition to the American Academy of Pediatrics guideline providing specific guidance on healthcare for patients with Down syndrome, this guideline also provides recommendations on how best to communicate a diagnosis with families. And I pulled out the bullet point list to share this evening. And to me, in some ways, I feel like some of these things seem like they should just be so obvious, right? Like, do you need to tell a pediatrician to use a respectful bedside manner when communicating with a family, or refer to an infant by name, or to congratulate new parents on the birth of their baby? But I think that much of what drives these recommendations that get very specific around communicating with families is the fact that many people have had a diagnosis experience that wasn't good, where they weren't getting, this basic, compassionate connection and recognition of their baby at the time of that pediatric diagnosis. So I think all of this is an effort to really improve those experiences for families through helping to educate and support healthcare providers to do better. Similarly, the National Society of Genetic Counselors, which is the professional organization of representing genetic counselors, also has guidelines around communicating a prenatal and a postnatal diagnosis for Down syndrome. And similarly, it gets into some very specific information about how to communicate a diagnosis, but also what essential information should be covered with that initial discussion around a diagnosis of Down syndrome. It should be noted that these guidelines were published in 2011, so this really predates, that's right around the time that cell-free DNA screening first kind of became available, and it was not used much in 2011 at the time these guidelines were written. So I think that we might think about things a little bit differently now, where you have a screening test that is not definitively saying that there's a diagnosis, but oftentimes has a pretty high likelihood that that's the case. That's quite different than the former screening tests that were used during this time. But you'll see here, I mean, the goal and the essential information that should be included in this discussion is beyond what causes Down syndrome and the fact that there's extra genetic material from chromosome 21, and beyond talking about specifics around medical issues and intellectual disability, but really giving information about what life could be like and helping support families to think about not only the medical aspects of what this diagnosis could mean, but really what life could look like for their child and their family, given this diagnosis, which in many cases is unexpected. I think with all of these guidelines, there's still a lot of improvement and work that needs to be done and how a diagnosis of Down syndrome is communicated, regardless of whether that's in the prenatal or postnatal setting. Stephanie will talk a little bit more about this as well, but I just thought it was worth noting that in addition to these guidelines, there are actually some states that have enacted laws, Down Syndrome Information Acts, which intend to provide some information to families when there's a prenatal diagnosis of Down syndrome. And I pulled language from Washington State where I live, but as I understand the law here, it is imperative that healthcare providers that are delivering a diagnosis of Down syndrome make certain information available to families. And this is, I think, a unique thing in a healthcare setting or related to a test that there would be, a need for laws to be enacted to help really guide care to families. But there's a lot of variability in this too. And as I mentioned, Stephanie will talk a little more about that. So something that's happened over the last, 10 to 15 years that I think is important to note with regards to genetic counseling is that the business of genetic testing has really grown and has become very competitive. Prior to NIPT, cell-free DNA screening, we didn't see commercialization of prenatal genetic testing or any genetic testing to the degree to which we saw it with the invention of this new test. And other types of testing as well now, like carrier screening, for example, sometimes hereditary cancer testing. But there are many companies that see that there is a business opportunity here in terms of selling genetic testing. And because sometimes the testing and the interpretation and the follow-up of this testing can be complex, many providers aren't comfortable ordering it without the support of genetic counseling expertise. And companies have seen that in order to encourage providers to order their brand of testing, they need to provide some genetic counseling support. So many labs now employ genetic counselors who actually directly communicate with patients around genetic testing. And this is something that has happened for a while, but it's really grown in practice a lot over the last decade. So what this looks like practically is that where previously many people might be seeing a genetic counselor that was working at in their community or at a tertiary care center, a big healthcare center in their community, they might be referred for genetic counseling around a test. Now many people receive this information from a phone call from a genetic counselor or a scheduled online consult with a genetic counselor that works for the testing lab. And this may be very limited in terms of what information is provided. It might be just a matter of disclosing those test results, and there might not be an opportunity to have continued conversation or really ask many questions related to that result and what it means. And I'm concerned that this is changing the way that we kind of view the role of genetic counselors, what genetic counseling is, that many providers might often see that those, results phone calls are genetic counseling when, I think that the view of a more comprehensive and holistic approach to genetic counseling and conversations with families is not being practiced through this manner. And there's been some concerns raised about conflict of interest where you're, a company that's selling a product like a genetic test. It's actually providing healthcare directly to patients. But it doesn't seem to be a practice that's slowing down in any way. So I wanted to talk to the Down Syndrome Diagnosis Network a little bit about that, because I would imagine that there have been people that have had different experiences with regards to genetic counseling through different channels. As far as insurance coverage and access to genetic counseling goes, I will say that insurance coverage for genetic counseling really varies a lot. I think it varies depending on location and also specific insurance plans. I know that, for instance, Washington State Medicaid has covered genetic counseling around prenatal testing for many decades. And so do many commercial healthcare plans in this area, but that's not across the board, and every state, many state Medicaid programs don't cover genetic counseling at all. And one reason for that is that Medicare does not recognize genetic counselors as healthcare providers who can be reimbursed currently. And while many people who are, we think about Medicare as coverage often most commonly for older people, it's not necessarily people who are pregnant or, have or pediatric patients or whatnot. Medicare really does kind of set the bar for what a lot of insurance companies will cover. So many Medicaid plans, many commercial plans are looking to Medicare coverage to inform their own policies. I thought I would take an opportunity to make a plug here about the Access to Genetic Counselor Service Act, which is a federal legislation that's been introduced and would allow for recognition of genetic counselors as providers that could be reimbursed under Medicare. And I think this would be this is a really important an important thing that needs to happen to support independent genetic counseling that's not tied to commercial interest, that can be reimbursed and supported as an independent service. And then lastly, just how do you access a genetic counselor? How do you access genetic counseling? Of course, in many communities, there are genetic counselors that are working in hospitals and clinics that might be in your local community. And there is this website, findageneticcounselor.nsgc.org, that's hosted by the National Society of Genetic Counselors. And you can search genetic counselors by specialty and zip code through that search tool, and could find resources in your local community. Genetic counseling is also being more commonly offered through telehealth and virtual means. Genetic Support Foundation, the organization I work for, provides genetic counseling via telehealth throughout the United States, and we see patients virtually through secure video visits, and also work with insurance, but provide financial assistance to cover the cost of genetic counseling if it's not covered based on financial needs. So hopefully those resources could be helpful if that's a consideration. And then last, I just thought I'd leave, that's my direct phone number, my email. If there's questions that come up, I'm always happy for people to reach out. And again, I thank you for the opportunity to talk to you all tonight, and I'll turn it over to Stephanie.
Although I will say, Katie, you've got a question in the chat that you might want to address before I take over. And Christy asks, how do they get by with calling that a genetic counseling session when it doesn't seem to be a full counseling session? And I think she's referring to the labs, but Christy, if you want to clarify that, that's
okay. And it might just have been a frustration that I was saying. I mean, it's probably obvious, but I don't understand how the medical company is allowed to call it, yeah, you get to speak with a genetic counselor and we're going to count that and it's going to be okay, when all the genetic counselor is saying is, here are your test results. That's it. I don't understand how that is a full counseling session and they can get by with it.
I mean, it's not, and I mean, sometimes they'll call it, you'll see, if you're looking on these lab websites and how they're marketing to physicians and physician groups, is they'll say, your patients will have access to genetic counseling services, and they make it sound like it will be comprehensive. Sometimes they'll call it a genetic information session. And what I've heard from genetic counselors working in these settings oftentimes is they are limited to the scope of what questions they can address, right? I think there are limitations, and that makes sense. I mean, the model doesn't support, an hour-long conversation if that's what their role is. But of course, in the kind of the marketing pitch doesn't show that oftentimes. And I think that's a frustration. That's a frustration for me, and I think a concern, but I think it goes back to the fact that so many people have no idea what genetic counseling is. So how do you know that that's not all it is, or that all it could be? And I think that kind of points to some of the different experiences that people have too with genetic counseling, is that it looks very different depending on how you access it. And I think that in many areas of healthcare, this would be like a no-go, right? You wouldn't, your, prescribing physician wouldn't work for the pharmaceutical company that was making the drug. But somehow this has kind of gone by, and I think needs some attention too. So.
And I guess I'll add a little bit more in there. I think that's why that Access to Genetic Counseling Services Act is so important, because since there's not universal coverage for it, there's similarly not a Medicare description for what that looks like, right? Like and also you don't have an infrastructure where, private entities can really support genetic counseling, because they're not able to get the reimbursement that they need in order to do it without, and that's where these labs end up stepping in, because you don't have a sustainable infrastructure in order to support genetic counseling through insurance reimbursement. So that's one reason why I feel pretty strongly about that as a patient advocate, because you want people to be able to get the best possible counseling session they can have. And actually, and I'll get to this in a minute, but we did find in some of the qualitative responses in some of our research that people were having not as positive experiences with some of the lab counselors where it was a quick session, because they weren't able to get a lot of their questions answered.
There is one more question for you, Katie, before I turn it over to Stephanie. So Heather, one of our wonderful moderators for one of our online support groups, wondered, she's curious why you would have to see a counselor more than once, especially once you receive your initial results of Down syndrome. Is it required to see a counselor annually?
No, I don't think that would be very common. I definitely wouldn't say that it would be a requirement. I have seen, I think oftentimes you might be seeing a family or patient one time and or there as a resource, but I think the ideal in my mind, but I think it's not it doesn't practically work out this way very often, but it would be nice if people who are even thinking about a screening test or any kind of prenatal testing could have an opportunity to have a conversation about what's involved in that testing and kind of the different aspects and what to expect from that for the pretest, and then the follow-up results could also be with a genetic counselor. Cases or situations where I've seen people multiple times might be they're just really adjusting to this information and have new questions that come up. And I appreciate the list of like the critical elements to cover during that first conversation that I share from the National Society of Genetic Counselors. I mean, that's a big list of information, and I think oftentimes at the time of a diagnosis, people can't absorb all of those things, So, I mean, I think ideally, if you can keep the door open and say, okay, what are your questions now? And how can I support you now with what information you need now? And the door is open to be back when you have those other questions that come up. I think that's ideal, but I think that, most of the time, it's not going to make sense for you to have an annual follow-up with a prenatal genetic counselor if that's who you met with. That once you're getting care through your primary care pediatrician, there might not be a need to come back, but there might be questions when you have a future pregnancy or or other things that you might come back for. I think it's nice if you have that connection and know that there's an opening to go back, but I don't think there's any kind of requirement for ongoing support.
One more question. Sorry, Stephanie. We will
Sorry.
we have time. I think it's a great question. Christy had asked, have the counselors through the genetic, easy for me to say, support foundation been vetted as counselors that will deliver information in a positive, supportive, informational way? I know even in the DC area, we are struggling with counselors that are not presenting a DS diagnosis well. And I just want to chime in that that is something we frequently hear in DSDN as well around the world, is that this, can be a tricky conversation for folks.
Yeah, this question about vetting, I appreciate. I mean, I wouldn't say that there's been a formal vetting process, but I would say like there's definitely a philosophy and an approach to like the way that we're providing genetic counseling and Genetic Support Foundation that I sure hope supports a more positive and supportive diagnosis. I think one thing that we've been encouraging for our genetic counseling providers that are seeing patients who are in the prenatal or pediatric setting is to go through some special training, which Stephanie will share a training resource that is available through Lettercase. But one thing that I've advocated, and this is like Stephanie and I talking together too tonight, I think that there's history there, and that, we crossed paths a decade ago, as I think a patient advocate and a genetic counselor that was really looking to build bridges with the patient advocate that could, give more, I think, insight and perspective from the lived experience and what she's heard and learned from family experiences through the years. And I think that's something that we've really encouraged for all of our team at Genetic Support Foundation, is to build and foster those connections. And I think that also helps. I'll say too, I think from the genetic counseling perspective, I don't know if this is going a little bit into a place I wasn't expecting to go, but I think I was really fortunate in my first job as a genetic counselor that I was working both in the prenatal and in the pediatric setting at the same time. I was working in a military hospital where the same families I would see during pregnancy, I would get to see with their baby after, in the pediatric setting. So I think that gave a bit of a unique perspective for me as a new genetic counselor. I think often now, if you see the kind of demographics of the genetic counseling field, it skews to very young people. It's mostly women, but you're often seeing people coming out of training programs, going into their first job as genetic counselors, and they might not have a lot of like really personal experience in working with people who have the genetic conditions that they're talking to people about during pregnancy, right? They have had their master's program and some experience, but I think a lot of that up front really, I think people's approach might depend a lot on that perspective and experience that they get through working with lots of people and families over time. So. Okay, thank you.
Sorry about that. I actually decided, based on some of those questions, to add a couple of details to my slideshow, because I realized there were a few additional insights I could give you for genetic counselors and reaching out. So I want to make sure to cover that. All right, I'm going to go ahead and share my screen. And also thank Katie so much for being willing to share tonight. She and I actually, like she said, we met at American College of Medical Genetics and Genomics conference, I think in 2011. So we're edging in on 15 years of being friends. And I think that's so key in being able to build bridges is actually developing real authentic relationships with people. And that include, because usually you aren't going to have that many genetic counselors in your area. Maybe in DC you've got a lot, but But in most areas, they're kind of just a handful of prenatal genetic counselors. So, and they tend to be an approachable bunch. So I think this is a really good opportunity to build that. So I'm going to talk about going beyond the genetic screening results and giving families comprehensive support and what that looks like when it's going well and when it's not, and how we can make sure that it goes as well as possible. Just a little background on me. I am the director of the National Center for Prenatal and Postnatal Resources at the University of Kentucky's Human Development Institute. I am also on the board of directors for the Genetic Support Foundation, so that's another disclosure for me, but I think also speaks to the organization that they sought out a patient advocate to be on the board. And I am the mom of Andy, Kate, and Lily, and Andy's my oldest with Down syndrome, and he is much cooler than I am, as I often say. And at our national center, we provide resources about different genetic conditions. It's not just Down syndrome. Down syndrome was our first, and it's translated now into 12 languages. We just added Swahili and German, but I still have to put those on the website, but we just got those translations done. And we also have our Down syndrome pregnancy program that is specific to Down syndrome, and that's for those who are preparing for the birth of a baby or who have a newborn. Lettercase is specifically for that first moment of receiving a prenatal diagnosis that can be so vulnerable and critical. We offer training to medical professionals on how to understand disabilities and support new and expectant parents. We offer training for advocacy organizations on how to build relationships with medical providers. We have information about all those different state laws, and we have a webpage about that I'll show you later. We do research on patient diagnosis experiences. And also we've been involved in a PCORI project looking at improving the dissemination of research and offering support to Black and Hispanic parents of children with Down syndrome. So we do a lot over here. And so I'm going to be listing the characteristics of a positive diagnosis experience and talking about that, and also how to empower clinicians in your area with resources and training. So, Katie talked about some of those different recommendations from AAP and from National Society of Genetic Counselors. And so, how do we think those recommendations are currently being followed in practice? And unfortunately, I don't have our genetic counseling results today, although I'll kind of talk through it a little bit, because we worked with 12 local Down syndrome organizations and also Down syndrome diagnosis network to recruit families to tell us about their diagnosis experiences. And we asked them yes, no questions about whether other obstetricians and genetic counselors followed those guidelines and best practices. And then we asked qualitative questions about what their diagnosis experiences were like, what was done well, and what could have been done better. And we specifically were looking at people who got a diagnosis between 2016 and 2021. So it's all really recent, because I think a lot of times this research that's been done, people could say, oh, well, that was 30, 50 years ago. Of course it didn't go well. And so we wanted to make sure that this was all, the most recent stuff. And we ended up getting 242 respondents, which makes it the biggest study published to date of those who received a prenatal diagnosis. And what we found out about OBs is that they were most likely to discuss medical issues, about 64%, which still isn't high enough because we want more than 2/3 telling us about the medical outcomes. 76% discussed reproductive options, and less than 40% of OBs discussed supports and services and life outcomes. I will say that genetic counselors performed better on all these questions by about 17%. So they did significantly better, but still not as well as people like Katie would like for it to be. I mean, these are leaders in the community who I work with who know what the best practices are. And so they would like to see that at 100%, right? And then 61% of OBs deliver the diagnosis as bad news or said, I'm sorry. And we use that as a measure for implicit bias for that group. And then we put the biased clinicians in one bucket and the unbiased clinicians in another bucket, and we compared them. When we did that, the OBs with implicit bias were significantly less likely to provide more comprehensive prenatal care, which that's huge because we're talking about actually giving information about heart defects and how to address that sort of thing, recognizing esophageal atresia. They were less likely to provide information about Down syndrome, life outcomes, advocacy organizations, and available supports and services. And looking at the percentages in one particular category, 51% of unbiased OBs gave patients accurate, up-to-date, and balanced resources about Down syndrome, which still is not high enough, but only 17% of the biased OBs did that. And then almost 1 in 10 described explicit bias that their OBs conveyed. And when I say explicit bias, that's actually a pretty high bar, because that means they had to say blatantly discriminatory or stereotypical information that is incorrect. And if we had 10%, so 1 out of 10 doesn't sound so bad, but if we had like 9% of clinicians saying blatantly, discriminatory language about any marginalized population, we would say that's too much, right? So, and again, the genetic counselors did perform better. We have an article currently submitted for press in the Journal of Genetic Counseling about the results for that group. And what we found for them was that we compared the answers to those questions and also their recommendations. And we found that those clinicians who followed the National Society of Genetic Counselors recommendations performed better in all the categories and in the sentiment responses of the patients who got that diagnosis. So the patients were feeling better about that diagnosis when their clinicians followed the guidelines, shockingly, right? That's why we have this. So what did they say clinicians could have done better? They wanted their clinicians to provide resources and information. They wanted a more sensitive delivery and good communication, referrals to support groups, and not to be overly negative. Now, they weren't saying don't say anything negative, but they were saying, look, give us some of the challenges, but also give us some of the strengths. We want both of those things. And when clinicians did a good job, the things that the patient said were that they provided support and empathy, they gave good health care, positive communication, provided information and resources, and they were respectful of pregnancy choices. A lot of people were upset if either they didn't get provided all their reproductive options, or if they expressed a preference and said they wanted to continue a pregnancy and they kept being offered termination after expressing their preference. So what does a good experience look like? This was a great description in our qualitative responses of what somebody said. So this was a genetic counselor who just hit all the marks, checked on how they were feeling. She went over the numbers about the possibility, because these were screening results of the baby having Down syndrome. She got a basket from the local organization that included the contact information, helpful books, as well as baby items. She talked to us about some reactions they could get when telling families. So talked about some of the psychosocial stuff. Didn't assume that it was bad news, discussed the pros and cons of the different testing options, and also gave all of the information about the condition, gave her contact information, like Katie was saying, so that they could follow up with concerns and questions. So this, so it can be done well. And this is a great example of what it looks like when it is. So here are some of those characteristics of a positive diagnosis. Clinicians are avoiding saying I'm sorry or saying I have bad news. And also 82.4% of medical providers in general believe people with disabilities have a worse quality of life. So it's important to kind of counteract some of those systemic biases that people have by giving them the real data that show that 99% of people with Down syndrome are happy with their lives. And 97% like who they are. So particularly postnatally, it's important to say congratulations about the baby, ensuring support, sharing the news with the parents together. So when you have partners, making sure that one person isn't having to tell the other person. And all of these are in Dr. Scottco's recommendations. Discovering and addressing any concerns, reflective listening, and sharing resources and support networks. So that's what it looks like to show compassion. With the reproductive choices, it's important to follow the patient's lead. And generally, that can be done by just asking about their pregnancy plans. Like, what are your plans for this pregnancy? And that could be any range of things with your birth plan, anything, and get that information and ask questions beforehand, and only discuss those other options for when those parents do express a preference not to parent. And that's going to be especially tricky, obviously, now with the Dobbs decision, and there's lots of different rules in different states, and making sure that, clinicians are able to navigate that. Oops, I skipped through because your beautiful faces are blocking what I can see on my screen. So there's that. I'm sorry, I'm going to move it for just a second. So keeping expectations open, avoiding sharing stories that reinforce stereotypes about conditions, and sharing resources that talk about a range of life outcomes. There is no one size fits all description of Down syndrome. It is a variable condition, and it's important to recognize that when having those conversations. I am so sorry. I'm having to move around Zoom things on here. And then the other is to understand current life outcomes. We want our clinicians to have that understanding of what's up-to-date information and not give outdated information. And to know that it's okay to say, I have to look that, if they have to look something up. We don't expect somebody to know everything. There are lots of conditions that they may be discussing, and just to have that cultural humility to say, I don't know, and I'll look that up and get back to you. And then it's important also to be providing a balanced delivery. There's a great study that predated the recommendations for the National Society of Genetic Counselors, and it looked at what genetic counselors thought was the most important information and what prenatal parents thought was the most information, and compared those. And so they found that, genetic counselors at that point were saying they really wanted to provide that genetic information. They really wanted to talk about the medical issues. They both thought it was important to provide written information, but the families also said they wanted those psychosocial outcomes. They want to know about therapy and support organizations. They want to know about friends. That sort of stuff matters to know what life is like for our kids. And they want a balanced delivery, not just the medical model, but also the social model. So when genetic counselors are doing that best job, they're covering, yes, the medical issues, but also cover the supports and services that help our kids to have the best possible outcomes, right? Acknowledge those challenges and strengths. Yes, our kids often have intellectual disabilities, but yes, they are also being included in their communities. They have access to post-secondary opportunities now. They're most likely included in their neighborhood schools. So even though there are definitely these challenges our kids face, there are also all of these great opportunities that have emerged in the past 50 years. And there's a lot of peer-reviewed research to back all of that up now. We have that psychosocial data, and genetic counselors would ideally be providing that. We also want to make sure that they're providing the best imagery. So, a karyotype may explain what the chromosomes look like, but it doesn't really explain what life is like. And then also, sometimes there's this outdated imagery from medical textbooks. We don't want that information either. That's scary and overwhelming. So what we try to do in our materials, and what the research has shown that patients want, is diverse representation, languages, and also showing what life is like in context. So seeing these pictures, providing contact information for national advocacy organizations. That's really important too. Down Syndrome Diagnosis Network is specifically included in the American Academy of Pediatrics guidelines, as are our resources, and it's important to make sure that those families are getting that national advocacy organization information. And we actually have a page on our website that covers it for a range of conditions. What are those national advocacy organizations? And so you are in a great position to empower clinicians with resources and training if this is something that you feel passionately about. We offer through our organization accurate, up-to-date, and balanced resources and information. They've all been reviewed by representatives of the national medical, genetics, and advocacy organizations to make sure that it meets their standards. And you can literally see clinicians relax when they see on the back of the materials which organizations were involved in the review, because they know that it represents the cross section of what all of those different entities think are important for patients. And so they're recommended in the AAP and NSGC guidelines. They're cited in the peer-reviewed literature, and our funding is largely provided by the Joseph P. Kennedy Jr. Foundation. And we have an overview, a little brochure that gives an overview of everything that we offer. It's all available for free. Just access it. We just want you to come take it. We have a brochure that gives an overview of delivering a prenatal or postnatal diagnosis of any condition, but you may, and so it's more global, but then DSDN also has this great one that's specifically just for Down syndrome. And again, just request it and they are happy to share with you. Another great resource you can provide your clinicians is the brochure about the National Parents First Call Center. And that includes parents who have been trained by a genetic counselor to provide peer-to-peer support, and it's confidential. And so if you're a local organization and maybe you're not quite, comfortable with handling some of those first calls, MDSC has this national call line that you can use. Or maybe you want to get trained by Sarah Cullen, who's amazing, who will train you on how to do that yourself. And that's possible too. We also have the National Down Syndrome Adoption Network brochure that you can provide your clinicians so that if there are families who are in distress, they are not in a position to parent, or they just want to explore that option, because Stephanie Thompson will tell you about 50% of parents decide to place a child for adoption and 50% decide to parent. But this is an option that, or a brochure that's available for you to provide them. We also provide free training for medical professionals, and you can share this with the medical professionals in your life so that they can have that training on what the most current outcomes are for people with disabilities. We cover the history in one of our courses, we cover the history of disability rights and how that's impacted current outcomes. And we have a lot of genetic counseling programs who use that course. I do it in person, and I'm scheduled to do it with 8 programs this next year. And they also, we have like University of Alabama, they take it online every year. So that's an option. We also have these courses, the Brighter Tomorrows courses, that are specifically for clinicians on how to deliver a prenatal diagnosis, and then one for a postnatal diagnosis. And it has little video vignettes showing modeling how to answer difficult questions. And then we have one course where we combine all of those together. And it's available for CEU credits for genetic counselors specifically. And National Down Syndrome Society is paying for them to take them for free right now. So if you share it with clinicians, you can say, hey, you can get these free credits, and they all have to get a certain number of CEUs every year to continue. So, and we have research showing that these training courses that we have increase the knowledge and the comfort levels of medical students in delivering that news. We also just released in the past couple months, an online course and a white paper that talks about how to improve the dissemination of research and supports for Black and Hispanic parents of children with Down syndrome. This was derived because our original research study, we had 242 respondents, and of those, only 4 were Black parents. And so that was not sufficient for us. And so we wanted to make sure that everybody's voices were included in our recommendations. And so this was a really intentional effort to do that. And so we recruited families from all over the country, and we also recruited their advocacy leaders, medical professionals, and health equity experts to help develop these materials to help you and medical professionals. We also have medical outreach training for advocacy organizations. We do online medical outreach training courses that you can just take at your leisure as asynchronous courses. And we can also do them in person. We offer monthly webinars with community practice meetings that are recorded. You can go on our website and check them out. And if you want to join, then you send us an email, and Nancy Iannone, who works with me, will send you an invitation. We offer technical assistance. You send me emails because you want to do medical outreach. I answer them, and I try to help you as best I can. We have a web page with downloadable materials you can use. And we can also talk to you about connecting with your genetic counseling program in your area, which is a great way to kind of develop that future generation of students. And because almost all of them are really excited to have lecture content, and we are happy to do that for them. But they also do, every second year genetic counseling student has to do a project, and a lot of them are interested in doing advocacy work and working with advocacy organizations. And it's a great opportunity for you to build those relationships that we talked about earlier. And a lot of times those genetic counseling program directors are the thought leaders in their areas. So it's a great way too to make connections that way. So I got through a lot of content in a really short time, and that is our contact information. I did want to show you really quickly. So this is our website. If you want to get to the resources, you just click here and you can click on to see them online. You can go to our bookstore, and this is all for clinicians. Clinicians can request free prints. They can get them online. And you see there, they just fill out their information and we not FedEx them. We use priority shipping from USPS, and we ship them resources. And the cool thing is they can request them about all these different conditions. And that makes it also appealing because they can meet their needs for lots of things. Or online, they can click to see these different resources here. Here's our training for medical professionals. You can see these courses. They're all available for free, everything we have there. This is our training for advocacy organizations, and you can see we have the online courses, including the new PCORI courses. And then we also have some of these downloadable materials like an introduction letter. But this is all stuff that should be done through your local Down syndrome organization. And then support, this is our support specifically for Black and Hispanic parents, and you can see that we have these white papers that give the recommendations for medical professionals. And we also have the online courses. And then finally, you can also check out your state laws. If you're like, oh, does my state have a law, a Down Syndrome Information Act? You can see if they do. We provide the link to the state law and also to they'll have some kind of handout or fact sheet, and we provide contact information or the information for that as well. And here's also some of our research, which I'm happy to share with you if you want it. And I was very happy to provide this. We actually, you have to pay to make something available for free, and we did. So we hope that you all access our freely available research. So got 2 last minutes, and I'm happy to answer any questions you might have. And I will go back to my PowerPoint so you can see my information if you want to send me an email.
So since there's only a few of us on, I think it would be fine if you wanted to unmute. And if you're more comfortable doing it in the chat, that's fine. I can read it for you. We just got a nice comment from Heather. Great information. Much appreciated. I agree.
Ooh, you know what? I actually thought of an answer to a question from Christy, if you want to see this. The other thing you might be interested in is if you go to our medical training page, we also have, actually, trained medical professionals. And this is a list of all of the medical professionals who have taken our training course and who have asked to be listed on the website.
That's cool. That's very
So
cool.
you can reach out to yours and even say, hey, I would love for our, the genetic counselors in our area to be listed as trained genetic counselors so that our families know that they can feel comfortable approaching them. So that's another thing you could possibly use as an incentive.
That's very cool. I don't see any in Maryland.
You had no Virginia or Maryland on here.
I was just going to say Maryland and Virginia are missing and entirely.
On a side note, Stephanie, I have to thank you. I'm going through the medical training for the advocacy. It is taking me way more than 2 hours to get through this class. Because it takes me on all these, I get caught. But thank you for making the direct link to where our state information is. The one thing that I have found is that when I use your direct link, I find the information right away, and it's great and super helpful. When I go to the Department of Health for Maryland, it's almost impossible to find what I'm looking for.
And I would highly recommend that you find out who to talk to, because we used to
I'm working on it.
like to say this is hard to find, because they
Yeah.
need to work on their web finding if it's difficult. Because I know Heather Sachs was working with them when it was originally done, and then you know, it gets buried in stuff. But I would ask Heather too, because she may know.
Okay. Yeah. But thank you for your direct link.
You're welcome. And if anybody ever notices my links are broken, please let me know, because I try to assign students to do that every 6 months or so. But sometimes these states, they will like redo their whole website and then links get broken and all that jazz.
Wonderful. Well, I think that might be everything. So I just want to say again, Stephanie, Katie, thank you so much for this. This information is wonderful. And it is something, like I said at the beginning, that a lot of our expectant parents in particular are wondering about, because this might be the first time they're ever hearing the words genetic counseling put together. And then we also have plenty of parents in DSDN who have been through the genetic counseling experience, the whole diagnosis conversation, and they're really hungry for information about how they can make sure that any parents coming behind them have a better conversation than what they had. So this is wonderful for both of those audiences to be able to take some great stuff and go forward. So with that, I will go ahead and wrap us up. Thank you again, all of you for being here. And this was going to be posted into our YouTube channel on DSDN, or excuse me, our DSDN channel on YouTube, so that if you do want to share this with anybody else who wasn't able to attend tonight, it'll be really easy to do that. So share it with anybody who might benefit from it. Thank you. Y'all have a great night.
Thank you.